on coronavirus. On any normal Sunday afternoon, many of you would have been out with your family and friends, enjoying the sunshine. And tomorrow, many children would be going to school for the first time after a 2-week break. But these are not normal times, and we're asking you to stay at home. So can I start by thanking you for all the sacrifices that you've already had to make and that you continue to make. I know this has not been easy, but it is the surest way that we have to protect the NHS and to save lives. I can report through the government's ongoing monitoring and testing programme, as of today, 482,063 tests for coronavirus have been carried out in Great Britain, including 21,626 tests carried out yesterday. 120,067 people have tested positive. That's an increase of 5,850 cases since yesterday. 18,118 people are currently in hospital with coronavirus in the UK, compared to 18,006 on the 17th of April. And sadly, of those hospitalised with the virus, 16,060 have now died. That's an increase of 596 fatalities since yesterday. We mustn't forget that behind every single statistic, there is a heartbreaking story, and my sincere condolences go out to everyone who has lost someone that they love. These are challenging times for all of us, and each of us has a role to play in fighting this virus. Those who are working in the NHS, those doctors, those nurses, those cleaners, those porters, those ambulance crews, they're all doing an amazing job. They're truly heroic in the part that they're playing in supporting every one of us in this nation. But today, I would also like to say how enormously grateful we are for those who are working in our nurseries, schools, colleges, universities, and children's services. I'm profoundly grateful for the vital role they're providing in our communities. They've been keeping schools and nurseries open, including over the Easter holidays, so that our most vulnerable children and children of critical workers can continue to be supported and they can be cared for. People are anxious to know when we're going to relax restrictions, when schools are likely to be fully back and open again. Of course, I want nothing more than to see schools back. Get them back to normal. Make sure that children are sat around, learning and experiencing the joy of being at school. But I can't give you a date, because before we do, we need to meet 5 tests. First, we must protect the NHS's ability to cope and be sure that it can continue to provide critical care and specialist treatment right across the whole of the United Kingdom. Second, we need to see daily death rates from coronavirus coming down. Third, we need to have reliable data that shows the rate of infection is decreasing to manageable levels. Fourth, we need to be confident that testing capacity and PPE is being managed with supply able to meet not just today's demand, but future demand. And fifth, and perhaps most crucially, we need to be confident that any changes we do make will not risk a second peak of infections. When we can be sure that we have met these 5 essential points, we can think about getting children into schools again, learning, mastering new ideas, and being with their friends once more. We will work with the sector to consider how best to reopen schools, nurseries and colleges when the time is right. Our first priority has always been protecting the well-being of children and young people, but particularly those vulnerable young people with special educational needs or a social worker. Schools are open for them, and we're working to make sure those who should attend do so. Places are available for children of critical workers too. With up to 130,000 children in school every single day, schools are helping to keep the country moving. And we're asking our local authorities and schools to ensure every vulnerable child knows that their school is there to support them, that systems are in place to keep in touch with those children who are unable to attend because of health reasons. I know that families of seriously ill and disabled children are particularly worried at this time, and I'm grateful to all staff who are working so hard to support their education, health and care, particularly those in special schools and residential care homes. Young people who have left care or just about to, whether that's from a foster family or residential care, are really vulnerable right now. So I'm asking local authorities to ensure that no one has to leave care during this difficult time. The £1.6 billion of additional funding announced yesterday will help local authorities give care leavers and other vulnerable groups the support that they need at this difficult time. To further protect children from harm, we're continuing to support Childline and working with the NSPCC on to call, and more adults will be able to raise concerns and seek advice about the safety and well-being of any child that they're worried about. Like the rest of the population, all our teachers have had to adapt very quickly to new ways of working. They've had to move resources online, work remotely, change the way they support their students as well as one another. I'm immensely grateful to them and to everyone who has offered their support, including those who've made resources freely available for schools, parents and pupils to use. We have already published an initial list of high-quality online educational resources, including how to support physical and mental well-being and materials for teaching children with special educational needs and disabilities. In yet another example of how we are at our best when we work together, some of our leading state schools have collaborated to open the Oak National Academy, which will be launched online tomorrow. This is a totally new initiative led by 40 brilliant teachers who have assembled video lessons and resources for any teacher in the country to make use of if they wish to do so. 180 video lessons will be provided each, all the challenges that families will be facing at the moment, and we determine these as part of the most comprehensive education package in the BBC's history, available on TV. We're ordering laptops to help disadvantaged young people who sit key exams next year. We'll also provide laptops and tablets for those children with social workers and care leavers to help them stay in touch with the services they need, keeping them safe as well as supporting home learning. And if disadvantaged secondary school pupils and care leavers who are preparing for exams do not already have internet connections, we'll provide free 4G routers to get them connected while schools are closed. We're also working with major telecommunications providers to exempt certain educational resources from data charges, so that this does not add to household expenses that may already be very stretched at this moment. Before I finish, I'd like to applaud the remarkable way our education community has responded to this outbreak. I'm enormously proud and inspired by the incredible spirit they are showing. Schools are supporting their communities in every way, from preparing food parcels to sharing their facilities with local hospitals. Colleges are manufacturing and donating equipment. And universities are working flat out to develop diagnostic tests. And of course, a vaccine, which will help us beat this invisible enemy. And to any young people watching, I wanted to say to you how sorry I am that you've been disrupted, you've had your education disrupted in this way. I know how hard it must be, and I'd like to thank you for making the adjustments that you've had to make. I know that you'll be missing your friends, your teachers, your lessons, and I want you to know that you are such an important part of this fight too. And I cannot thank you enough for all that you are doing. This global pandemic is the biggest threat to our country. It's the biggest threat that this country has faced in modern times. If we all continue to work together as we have been, and if we continue to stick to the advice of our experts, we will come out the other side and be able to begin the task of rebuilding our communities. I'd like now to hand over to Jenny, and then we will take some questions. Jenny.
Thank you, Secretary. So I'm just going to talk briefly through 4 slides, which many of you I know will be very familiar with, but just to highlight the hard work actually that you as the public have achieved and the projection ahead as we see it. So the first slide is indicative of the social distancing measures we've all been working hard to achieve. And I think we need to congratulate ourselves, but also maintain these measures as we go forward to ensure that we keep control of the pandemic as it is. This slide shows that since February, there has been a more than 60% drop in our use of transport over all transport types, and particularly in rail and tube, recognising that it's just our essential workers who are going to work at the moment, and usage on that is down by 95%. We've had a little blip, if you like, over the Easter period where people have been at home anyway, and those normal levels, normal levels, if you like, for pandemic status are now resumed. So I think a lot of really good work, but work that we need to continue. Next slide, please. Again, we usually look at the number of UK cases which have been confirmed. These are reported when lab tests are completed. It may come a little time after the initial laboratory test. And what you can see here is a rise in the cases that we reported through March. And although there is some variation on a day-to-day basis, in general, there is a trend for the number of cases to be plateauing out now, and that is despite increased testing capacity. And that, I think, is reflective of the social distancing measures that we've had, but are also reflected in our hospital data as well. Next slide, please. And this slide shows you the number of people in hospital over the time period since around the middle of March. There's a few dips in this, which we recognise from data collection, for example, around the early phase in April, but you need to look at the general trend across the picture. And for London particularly, it demonstrates not only the very significant amount of work that our hospitals have been doing, particularly around the start, first and second week of April, but also the success which is occurring now in the number of cases coming down over time. Now, again, there will be variation as we go forward. We shouldn't be looking at specific day-to-day variation, but it is the trend in that period. Equally, you can see that other parts of the country have had slightly different pressures on their systems, and it is really important that those areas continue to practice social distancing so that their hospital systems as well remain fully able, as they are now, with significant capacity in critical care and in normal bed utilisation, to manage all of the patients who need hospital care. Last slide. And then the last slide here is around our global death comparison. Again, this is one which, as a public health specialist epidemiologist, is one which we need to reflect back on many months ahead, in actual fact, because of the difference in the way which different countries and different systems collect data. But we want to be able to show you what is happening in the UK and how that relates as far as we possibly can to other countries. And you can see there are two lines on this one. The UK hospital-only data, this is very robust data which is readily accessible. And you can see that blue line progressing on the right, but we like to think is starting to even out a little bit. And then you will see to the left of the slide a UK all settings data line, which is reflecting the fact that we have a lag, if you like, between our community death reporting and this endeavours to try and display, in line with some other countries' recording mechanisms, how the UK is managing to that extent. Thank you.
Thank you ever so much, Jenny. And I think the first question that we've got is from Hugh Pym at the BBC.
Thank you. Can you comment on reports today that stocks of PPE were allowed to run down in the couple of years before the pandemic? And why was more not done to get hold of more PPE in March and early February?
To secure PPE from right around the globe, but we've seen so many brilliant British businesses repurpose themselves in order to be able to provide it, and we've seen many educational settings also being able to do it. But, you know, the government, from the first moment that we were in a situation where the scientific advice was highlighting to us that we were facing a real challenge in terms of the coronavirus, and this could potentially evolve into a pandemic. Every resource of government has been deployed to not just expanding what we need in terms of PPE, but also ventilators, and we've seen a massive growth in the number of ventilators that we have available in our hospitals, and keep adding and building to the stock of what we've got. I'm not sure, Jenny, if there's anything extra on PPE that you wanted to add.
Happy to. So I think we perhaps ought to just step back a little bit and start from the beginning of, so the fact that there is a pandemic influenza stockpile demand on our supply. And I think we have had, if I might say from my own professional perspective, we could perhaps have a more adult and more detailed conversation about PPE supplies. For example, quite rightly, the conversation at the moment is very much focused on gown supplies. Earlier weeks, I'm very aware of consideration of eyewear, for example, in goggles and masks. And I think it is important to remember that although there may be elements of distribution problems, and we have managed actually, despite signalling many potential shortfalls, to continue to supply going forward. And even as I stand here, I know with the gown position, for example, that even though when orders go in overseas, supplies may be very different, what is received to what we think we're going to get. We have worked right across the UK to try and manage those supplies based predominantly and always on a risk mitigation method. So this is about whichever patient or whichever healthcare worker at highest risk across the UK requires those carefully through what has been achieved and the challenges which are acknowledged ahead. Thank you.
Hugh, I'm not sure if there's a further question.
Can I ask a quick follow-up?
Oh, of course, yes, please.
Yeah. I mean, some companies are still saying, even this weekend, they want to make and supply the PPE. They're offering it, but people at the centre are either not replying or just not coming back to them.
I mean, we've seen it nice to support our NHS, support those care homes. We need to be looking at every way that we can bring in more. I encourage them to, through yourself, to be able to make sure we pick those out and we make sure that we get in contact with them over the next 24 hours if they've sort of in any way slipped through the net. We recognise this is a national endeavour, and we're so incredibly grateful for so many people who are willing to step forward and make a real difference, and we certainly don't want to miss out on those opportunities. So please do send that information to us, and we'll make sure that we chase those up within the next 24 hours. Thank you ever so much, Hugh. If we go to Dan Hewitt.
Or nurse who refused to go to work because they feared they weren't able to access the correct PPE, are they right to back them? Would you both personally be comfortable today working on a COVID ward, having to reuse what's meant to be single-use PPE? And secondly, to the Secretary of State, on the 30th of January, the World Health Organization declared a global health emergency, yet Boris Johnson didn't attend a single COBRA meeting until over a month later on March the 2nd. What was he doing in the meantime that was more important? And is it acceptable that he was being briefed rather than attending any of those meetings?
Yeah, so Dan, thank you ever so much for that. If I maybe pick up the latter half of that question, and Jenny will maybe able to sort of be able to speak a little bit more on the PPE side of things as well. The Prime Minister, from the moment that it became clear that there were challenges in terms of coronavirus developing in China, has absolutely been leading our nation's effort to combat the coronavirus, making sure that resources and money is not an issue or a concern for any department, especially the health service, in terms of dealing with this. And as you will well know, and I know as an experienced journalist, you're very aware of this, many COBRA meetings take place, and I've spent many hours attending COBRA meetings where it's actually led by the departmental minister. But the focus that the Prime Minister was putting on this and can just continue to put on this has meant that this is the whole government effort. We're making sure that we do everything that is required and everything that is needed to make sure that we protect the NHS and make sure that we save lives. And that is the government's policy, and that is what the Prime Minister has been driving right from the start and when there are those initial concerns about this development of this virus. Jenny, I'm not sure if you'd like to pick up on the PPE
happy
point.
to. So I think I'm not going to comment on behalf of the NHS Confederation. I'm going to comment as a healthcare professional. If I happen to be working on the front line today, I have a responsibility to look after patients to the best of my ability, to protect my colleagues and my staff, and to manage my practice safely. So all of those in the current climate will mean that I need to understand the agreed guidance on PPE, which has been agreed with all of the Royal Medical Colleges, and to implement that whenever I can. I think this use, and it goes back to my comment earlier to Hugh Pym, it's very easy to make a throwaway comment about single-use PPE. Some PPE is single-use. Some PPE that has previously been used in different diseases, in different settings, may be single-use. But we have very detailed guidance now about what PPE should be used in which settings. It is actually quite complex, which is why as a professional, I think there is a responsibility on me to understand that. And it is the fact that we are in a global shortage, whether we are in the UK or whether we are internationally, actually, we all need to use this PPE carefully. So I think it's really important when you say, I mean, obviously we can't do a description here, but if there was a particular intervention, some sessional use is entirely appropriate. So for example, wearing a gown for sessional use with a disposable plastic apron on top of it is an entirely appropriate use of PPE. And in that example, you can see there is one element of what some people may call reuse and one element of what some may call single use. So it's really important not just to consider an item of PPE outside a particular care setting, but really be careful to apply that. So, and I think that's what all professionals will want to do.
Dan, I'm not sure if you want a follow-up question at all.
Yeah, on the PPE issue, we know that the flight from Turkey bringing in supplies that Robert Jenrick announced to us yesterday has been delayed. Even if that had arrived today, we know that only would have supplied the NHS for a matter of days. So what's taking place between now and this time next week or next Friday to ensure that NHS trusts aren't going into yet another weekend facing the prospect of running out of certain items of PPE?
I think, Dan, and it's a very important question that you raise. I think we all recognise the enormous strain that's been placed on the whole system. And we also recognise that right across the globe, people are actually trying to get the same items of PPE from quite a limited number of suppliers. I think it's important to thank the Royal Air Force that's on standby in order to make sure that this equipment is brought from Turkey, and we hope to see that coming into the country. Tomorrow. But we do recognise that we need to be working constantly in order to be able to boost supplies. This is why we brought in Lord Dayton, in order to spearhead the government's response and actually coordinating. We don't want to see anyone in a setting that doesn't have the equipment that they need to do their job. Jenny, I'm not sure if there's
Yes, just to add some sort of real practical tangibility to that, there is a cross-government board which meets. I'm part of that board to ensure, as I've said from the start, that clinical prioritisation is there. And when I say clinical, it is not just across the NHS, it is around social care sector and other parts of the system which need PPE as well. So, for example, funeral parlour staff, for example, but in the right proportions, and we work across the UK to ensure that each group of staff is prioritised according to that need. The Health Minister is updated on a daily basis on some quite detailed information about PPE run rates and flow rates, and we look ahead all of the time. As I've said, although there is massive ordering ongoing, it's not always possible to predict that the order that we think is going to arrive actually appears in quite the same proportions and content as we planned, and obviously that is an ongoing monitoring activity. There are meetings going on 2 or 3 times a day on a daily basis.
Thank you ever so much, Dan. And next we go to Liz Bates at Channel 4. Liz, please.
Hello. Yeah, I have 2 questions, if I may. First of all, to Dr. Harris, do you know what the gap is in survival rates between different hospitals across the country? And are you going to publish that data? And what are you doing to ensure best practice? And secondly, another question on PPE. I mean, you set out your position many times. We've also heard many stories of health workers without the proper equipment that they need. Can you say to those people now that are going into work day in, day out, risking their lives, that they will get the protective equipment they need to keep themselves safe and their families safe? Or should we expect more cases of frontline health workers without safety equipment that they need?
Well, thank you ever so much, Liz. And just on the latter part of your questions, a few weeks ago, much of the debate was about ventilators and the need for more ventilators. And there's concerns about the health service as to whether the health service would able to cope. And what you saw is a national effort to make sure that we had enough ventilators. And what you're seeing in terms of PPE is very much a national effort to make sure we do that. We recognise that we need to be backing up those so many amazing people, not just within the health service, but more broadly right across the country with the right levels of PPE. We are going to do everything we can do to deliver for them. We recognise they're doing an incredibly important job, and every part of government, but every part of the nation is doing what it can do to meet that. Jenny, I'm not sure if you want to mention anything on survival rates.
Yes, so perhaps just a question back. You mentioned best practice. Was there a particular element
that are playing into that, are being used to develop that?
Okay, I think quite separately from COVID or anything else, we have quality monitoring programs effectively, and we have professional groups who will monitor themselves as well. So, for example, doctors, respiratory physicians or intensive care specialists are forever comparing their data and their practice in order to learn from each other. And that's not just in this country, that is from overseas as well. There are particular elements of this which I think at this stage are quite difficult to tease out, and I think we will as we go forward. You will see over the coming months and years, not just in the UK but internationally as well, a whole number of research papers looking and comparing to see what different elements of practice have been successful. But obviously at this stage we want to be identifying elements which are successful and implementing those as quickly as possible, but being sure that the evidence that we have actually says that is the case. And then if there are differential rates for survival, for example, and I'll just come back to that in a moment, then clearly we want to identify any factors that would be involved in that and to try and improve them. Now, it's a very, very complex picture at the moment. So in terms of best practice, obviously you'll be aware that there are a number of trials running, and that is a classic example of trying to ensure that we have very strong evidence as early as possible. It's been a very, very rapid research call and implementation, and we will act on results of that as soon as it's safe to do so. In terms of survival, it's quite difficult because every person who comes into the hospital is an individual. We're all very, very different. We were talking previously, for example, around ethnicity. We know that actually if you're male, you're more likely to come off more badly. We know that children appear to be less affected. We know that it's a risk if you have other underlying conditions. So each of those factors, what we may call a confounding factor in our analysis, in terms of who survives and who doesn't, needs to be properly accounted for. So the short answer is yes, and there are data collection. There's a collection of data called ICNARC, which the intensive care consultants use routinely, and we'll be looking at it. There's specific data aligned with COVID as well. But it would be quite early to say at the moment. As soon as there are any specific factors, then obviously we try and highlight those. And in fact, one of the early elements that's coming out of this, and in fact a little bit like flu, is that obesity is actually quite a risk factor as well. So there's a mixture of individual risk and how that plays out.
I just wanted to ask, it did sound like, to you, Secretary of State, it did sound like what you were saying on PPE was, we're trying our very, very best, but we still can't really guarantee the safety of every frontline health worker.
We recognise that there are key areas of pressure within PPE, and as Jenny touched upon, the pressure points have actually shifted over the last few weeks in terms of what types of PPE are required. We recognise there's a big pressure, but what I do want to assure you and all your viewers that we're doing absolutely everything we can to bring as much PPE in right from across the globe. We recognise it's a big challenge. We recognise that we've got to be supporting the people who are supporting our nation in terms of the health service, and we'll continue to focus on doing that. If we can next go to Tamara Cohen from Sky. Tamara.
Education Secretary, on schools, from what you've said, we're not expecting schools to reopen in the middle of May, so parents and pupils are preparing for many more months at home. We've spoken to teachers at schools where not a small minority, but 30 or 40% of have a difficult home environment in which to learn, and teachers are really worried about the long-term implications of all this. What are your plans to prevent some of these children falling behind permanently? For example, do you expect schools to stay open over the summer holidays? And can I ask Dr. Jenny Harries, we're looking back intensely at the period in February and March where potentially not enough was done to curb the spread of this epidemic. At the end of March, when the World Health Organization said their message for the UK, do you now think that failure to do more community testing was the wrong approach?
Tamara, I think you raise a really important point, and it's something that as Education Secretary I worry about immensely. Of course, you always want as Education Secretary to see schools full of children because you know that children benefit so much from being in school. And I think that many families right across the country are learning about some of the challenges of supporting their child in terms of home education. But you touch on that really thorny issue sometimes of those children that aren't getting the support from home. There may be those children who are in care. There may be those children who suffer disadvantage. I mean, many of us take it as a given that we have good internet and IT facilities at home, but that just simply isn't the case for every single child around the country. That's why we've announced this package of measures to help some of those children who are from that most disadvantaged background. Because it is a worry for me that those children from that disadvantaged background are going to fall behind. They're going to struggle to catch up. That's why we're doing the things that we're doing, supplying them with IT equipment within their home, helping and supporting them, and also helping and supporting schools to do teaching in the home, helping those children to really succeed. And we recognise there's going to be a whole raft of things that is schools, colleges, nurseries, and of course government need to come together in order to be able to support those children to really succeed in life. I don't want to see children falling behind, and I'll do absolutely everything I can do to make sure that no child, whatever their background, is falling behind as a result of this crisis. If I can hand over to Jenny.
Yes, thank you. I recognise that my commentary, which I'm actually going to stick with from that period, has been reinterpreted several times. I'm getting very used to this. I think at the time that that statement was made, many of the countries around the world did not know that they had a problem. And one of the reasons for WHO to be reinforcing the importance of testing was for countries to identify that there was a problem. That was not the case for the UK. Wuhan, we quarantined people under very strict quarantine regimes from high-risk areas. We followed up individual cases and families wherever that was possible. But once you end up with seeding and cases which we recognised across the community, our focus has to be, and I still think this is correct, on managing the clinical conditions of those individuals, and we have continued to do that. In an area where, in an ideal world, perhaps if you have endless resources, and I mean that in terms of people, I don't mean it in financial terms, but mechanisms for following through, testing, contact tracing and going on, it's an important approach to be considered. But I think what's interesting at the moment is the UK continues to be compared with Germany, and there has been a lot of comparison, and we will continue to do that. It's very, very important that we learn from other countries. But actually, German rates of disease are starting to rise now. We are still at different phases of this pandemic in different countries. And the important thing I always look for, or what I'm trained to look for, is to say, if I do this intervention, what is it that I think is going to happen? What evidence do I have that we would change a course or alter that? And I think we have rather ended up with a conversation which was a demanding on testing. It's an important one for us to investigate. But I think the actual mechanism between the two is still not clear, and we must therefore, as you've indicated, continue to look at that. As our cases drop, if we have more digital mechanisms potentially, but again, fraught with difficulty, I think, in implementation, then there may be an opportunity to use testing in a different way to that we used during the containment period.
Tamara, I'm not sure if there's any follow-up on those two questions at all.
Can I ask you a quick follow-up on schools?
Of course you can.
Which is that you didn't say whether schools would need to stay open over the summer break, but if that is an option being considered, and also whenever schools end up going back, whenever the science allows them to go back, do you see it being phased, and do you believe any form of social distancing is really feasible in schools?
I think we recognise the challenges of anyone who's a parent of trying to instil social distancing in small children. And we have to understand really that sort of broad context. We are in a stage in terms of dealing with this pandemic where there are an awful lot of questions that sadly people would love to have answers to, but in terms of how the virus develops, we have to see that. There are currently no plans to have schools open over the summer period, and we hadn't been working on plans to have them open over the summer period. But what we are looking at is different ways, such as I touched upon earlier, the Oak National Academy, of actually how we can provide resources for children right across the country, making sure that they can have the ability to catch up on their learning. Thank you ever so much, Tamara. If we can go to Hugo Guy at VI. Hugo.
Thank you. Secretary of State, are you looking at what's happening to schools in countries like Denmark, where they're trying things like staggering the school day, reducing class sizes to allow schools to reopen eventually, even if you can't put a timescale on that, but to do that with innovations that make them safer places? And can I ask Dr. Harris, you said just now that testing is not necessarily the reason why the UK has so many more coronavirus deaths than many other large countries. Do you know what the reason is then? Why do you think the UK has been so much worse hit than many other large countries?
So if I touch upon the point as to are we looking at other countries and learning from them, absolutely. And we're seeing a few examples of countries opening up their schooling system, and we'll look closely as to how that works, how that goes, and what lessons can be learned from it so we can benefit from that. Jenny.
We have a difficulty in understanding the variation potentially between different countries and what steps are there to be clear what it is that may be causing variation in patterns across the country. Now, Germany stands out currently, but again, I think we need to be very clear. We need to look back in 12, 20 months' time on this. Germany currently stands out as different to other European countries, but in fact, the UK is not sitting at the top of the European list, if you like, of deaths at the moment. It's really important we understand what this means. Counting deaths, I know it's a sad thing to talk about, and it's something which has had a lot of focus in the media recently. But actually, probably the most useful statistic going forward to compare between countries would be what we call an all-cause mortality. So it's actually looking to say, what is the difference between now, when we have had a pandemic, regardless of what the individual has died from, and what we have had in previous years at the same season and with an age adjustment for that population. And all of those different things will vary between different countries. So it's very difficult to draw direct comparisons. It's not an excuse, it's a fact, it's an observation. And if we don't do it very carefully, we will go off into patterns of exploration which actually don't give us the answers that we need to manage either this pandemic or similar disease occurrences in the future.
Hugo, is there any follow-up questions that you may have?
Yeah, well, thanks for that, Dr. Harris. So just to clarify, are you suggesting that it will take a year, 2 years or more before any realistic, useful comparisons can be made between countries?
I'm not suggesting any useful ones. I mean, obviously, we do that on a daily basis. The very fact that we are talking here in this conversation about Germany as one example and many other countries as well indicates that we are all very alert to the fact that different countries may be experiencing slightly different rates. What I am saying, though, is we need to be very, very careful about our comparisons and take into account the age population in a different country. So Italy, for example, appears to have been extremely badly affected in terms of death rates, but there are very different family dynamics, for example, potentially more multi-generational units, potentially a higher proportion of the elderly, all sorts of different variables, both in population makeup and in the culture, and in how the health service manages, and in how public health interventions are implemented. So all of those need to be taken into account before we jump onto one side or another.
Thank you very much, Hugo. If we can go to Kate Devlin at The Independent.
Hello, two questions, if I may.
Of course.
Asked this morning if we were past the peak of the virus. One of the government's own advisors, Sir Jeremy Farr, said yes. Do you agree? Could we be past the peak? And secondly, if I may, last week The Independent saw a leaked email to NHS trusts which warned that a sustainable supply of gowns would not be with them until mid-June. Will doctors and nurses be facing a shortage of gowns for another 6 weeks?
Well, Kate, I think you'll want the expert medical sort of response in terms of whether we're past the peak as against necessary for me. But in terms of PPE and gowns, we recognise this as a challenge, and we recognise that it's a global challenge. But going back to what I'd said earlier, the whole resources of government and the whole resources of a nation are really focused in terms of dealing with that and making sure that we have a gown supply that is needed by our amazing NHS and the work that they're doing within it. If I could ask Jenny to comment on the issue in terms of whether we're past the peak.
UK deaths were down to 596. That was from 888 yesterday. We could jump to all sorts of positive conclusions about that, but we shouldn't. We should be extremely guarded. It's a weekend day. We know that hospitals will tend to report later on. I would anticipate those numbers will go up tomorrow. However, and without actually directly answering your question, because I would be much too cautious at this point, I do think it is fair to say that we do know from the hospital data, and you've seen from the slides earlier, that we are now starting to plateau across. And if I look at the number of patients, inpatients diagnosed, it doesn't mean these are the total number of cases across the UK, but they are down by 30%, let's say, just on average, moving around on a daily basis from about 8 to 10 days ago. So I think it's not fair to say that we are past the peak. And of course, the obvious statement to make is if we don't keep doing the social distancing, we will create a second peak, and we definitely won't be past it. So this is no reason to consider that we have managed this. But I do think things are looking to be heading in the right direction.
Kate, is there a follow-up question at all that you have for Jenny or myself?
Yes, and correct me if I'm wrong on this, Secretary of State, but it sounds like as of today, you cannot tell doctors and nurses a date for when this shortage of gowns will be solved. And do you understand that's incredibly worrying for them?
I very much understand the worry that people would have over this, and this is why, you know, we will be getting in the extra 400,000 gowns in from Turkey tomorrow. We'll be making sure that we are bringing further protective equipment, including gowns, all the way through, because we want to make sure that there is that continuous supply. But this is an incredibly fast-moving environment, but every effort of government, every effort of the NHS is being put into making sure that they have that continuous supply that our health service quite rightly expects and needs for those who are on the front line. Thank you very much. If we can move to Amy Gibbons from the Times Education Supplement.
Good afternoon. Education Secretary, should teachers working in schools during the outbreak have PPE?
Well, what we have done is we've worked very closely with the whole sector in terms of issuing advice as to what type of protection that they need. I mean, I have to say, as someone who has family members who are working in schools, as someone who very much sees firsthand the amazing work that's been done by teachers, teaching assistants and all that, you know, who are going into schools at this time to make sure schools are open, we're really in awe and appreciation for what's been done. But their safety and is absolute paramount, as it is for children. And we've issued guidance, we've worked with the sector and we've explained what's needed and what's required and been very clear about that. And we've asked Public Health England to work with, spoken directly with unions as to what is required to give them the reassurance that we're doing everything that is required to support teachers and all those who work in schools. I'm not sure if you've got a follow-up question at all.
Yes, please. I wanted to ask, what scientific advice has the government received on the safety implications of reopening schools for teachers?
So, as I set out right at the start, there are 5 key tests that we have put forward as to they need to be passed if we're going to be in a position when we start changing the restrictions that we're currently operating under. We're already talking with the sector as to what needs to be done and how we support them for when we start bringing schools back fully and operationally as we'd usually expect to see schools. But finally, one of the key points we also need to ensure is that people have proper notice so that they're able to prepare, whether that's teachers and those who are working in schools, but it's also about parents and children, those families who are having to deal with the consequences of this pandemic and making sure that they have enough notice in order to be able to plan. But at every stage, we've tried to give us clear and comprehensive guidance about the safety of those who are working in schools and, of course, those children who are in schools. I'm not sure, Jenny, if you have anything to say about the sort of safety of those who are working in schools.
Yeah, so I mean, right at the start of the pandemic and the implementations that we considered, if schools had been unsafe places, they would have been closed very much earlier on. And I think we need to keep that in mind. Schools are really important places for learning and for socialising. But they were not a key element of risk, if you like, in the early modelling work which was done. As we go forward, we need to be really careful. We're in a different context. So obviously, what was when we first started off, we need to change and we need to look at what change in an intervention will result in what outcome for our population. And one of the key issues with children, thankfully, we do know that they seem to be less severely affected by this, but we still have a huge amount to learn about the virus generally in terms of its transmission, and that is particularly the case in children. So I think there is still a lot of learning. We will be looking at that again, as I've mentioned with other responses. We continuously keep an eye on international evidence where other countries have looked at similar things, and the Scientific Advisory Group for Emergencies will continue to look at that as well.
Thank you very much, Amy. And if we go finally to Kit Sandyman from the Nottingham Post. Kit.
Thank you, Secretary of State. The lack of PPE in social care has been a critical issue in Nottingham, as it has around the country. Our local resilience forum received 40% of what it was told to expect in its first delivery. And the leader of Nottingham City Council has said that it's been haphazard and inadequate, and essentially said that promises made by the government have been broken. Do you think there's a argument that you've overpromised on the delivery of PPE? And secondly, when the shipment of PPE from Turkey does arrive, can you tell us how it's going to be distributed and allocated, and whether social care is going to be put on an equal footing to the NHS?
Well, before I go answer those questions, if I can just take the opportunity to thank the two brilliant universities in the city of Nottingham who have been playing an incredibly important role in terms of dealing with the coronavirus crisis, whether that's the University of Nottingham and Nottingham Trent University, who have actually lent key testing equipment in order to boost the nation's capacity and also to do tests, but also are working in terms of a mapping of the coronavirus so we can best understand to treat it. And it really, the City of Nottingham goes to shine the light as to what an important role higher education institutions play in terms of our battle with the coronavirus. You raised an important point, and that important point in terms of those social care settings, those homes. And right at the start, we recognise that local resilience forums, which Nottingham City Council is actually part of and a key player as part of, actually are vital in making sure that we get the distribution right on PPE. So equipment is getting into care homes and many other such settings, and that will certainly be the case, making sure the right equipment gets to the right places, and the local resilience forums will play a key role in that. I'm not sure if you would like to add anything at all, Jenny.
Thank you, Secretary of State. So I think perhaps what isn't evident just from discussing PPE generally is just how complex the distribution system is. And that represents the fact that, as you've highlighted, the care sector are really critical in our response. And that's not just the care sector in care homes, it is individual care workers working on a domiciliary basis on an individual client's home as well. And that poses challenges in itself. So if you like, on the one hand, there are quite well established, or were at the start of this process, hospital drop systems. We have had to develop much broader ones to reach right out to the care sectors more generally. But even so, and as Secretary of State has said, the LRFs actually are extremely critical in scooping up, if you like, an opportunity for us to ensure that we can reach those very small care homes, independent care homes or individual care workers who might not otherwise feature in some of the bigger national planning. So they are a critical component of this. I do know that there have been 2 drops out to LRFs recently. There are 2 more. The first, a third drop 3 planned for tomorrow, the 20th of April, and hopefully another one actually the same day, a 4th drop. So these are ongoing. So the LRFs who have experienced receipt of PPE, it doesn't mean that this is forgotten, it's on an ongoing basis. But going back to some of my earlier comments, it is also really important that we don't just drop a certain amount of stuff in PPE in one area or a few areas where LRFs can use it and leave others with frontline staff unsupported. So it is inevitable, but where there are potential shortage supplies internationally, we want to do more frequent drops to ensure that critical staff on the front line are given the right equipment and have that. And that inevitably means there will be smaller quantities over shorter periods of time until individual PPE lines stabilise.
Kit, is there anything further that you'd like to ask?
Yeah, just on the reopening of schools, if I could.
Of course.
Is the timing of that dependent on you feeling that schools have an adequate supply of cleaning materials, hand sanitizer and that sort of thing? And if so, what guidelines are being drawn up to give to the schools and the trusts to make sure that those schools can be as safe as possible for parents and children and staff when they do eventually reopen?
Well, Kit, we've already issued an awful lot of guidance on this, and it's available on the gov.uk website. There's if you want to be able to access, and I can organise for someone to be able to send you a link in terms of how we've been advising schools in order to deal with the challenges, because we mustn't forget many thousands of schools have continued to remain open over the last few weeks in order to be able to support vulnerable children and the children of critical care workers as well. So, but we'll constantly update that advice. But I have touched upon the fact that the key element as to when the decision is to open schools will be when those 5 tests that were set out by the first Secretary of State at the end of last week, when they're met, then we're in a position to look at how we change the restrictions that we're currently operating under. Well, I'd like to take the opportunity to thank everyone for taking the time to tune in, but also for making sure that they have continued to adhere to the guidance that the government has issued, making sure that we protect our NHS and save lives. Thank you very much.